Potential warning signs of cancer that people too often ignore. Many people around the world suffer from this terrible disease, which means that you should be very careful, and it's very important for you to pay attention to these warning signs and symptoms. The bad thing is that most people usually ignore these symptoms. It's very important to diagnose the condition in its early stage so you can get proper medical treatment. There are more than 200 types of cancer. The most common types include lung, prostate, breast, ovarian, bladder, colorectal, kidney, renal, pancreatic and endometrial cancers, as well as melanoma and leukemia. The survival rate for most of these cancers, especially lung cancer, is often quite poor because more often than not they are not diagnosed until they are already in advanced stage, making them harder to treat. So be careful and don't ignore these warning signs. Retzel bleeding. You'll be shocked when we tell you that colon cancer is the third most common cancer in women. One of the hallmarks is rectal bleeding, which many people link to hemorrhoids. The most common cause, red or dark blood in your stool, means you should visit your doctor. Bloating. Did you know that ovarian cancer is the #1 killer of all the reproductive organ cancers? These are the most common ovarian cancer symptoms. Bloating, feeling that you're getting full earlier than you typically would when eating, changing bowel or bladder habits such as urinating more frequently, low back or pelvic pain. Unexplained weight gain or loss. Here's what you need to know. Well, you shouldn't be worried if you suddenly put on 5 pounds but gaining excess weight month to month, especially if you usually maintain a normal weight. It can be due to a buildup of fluid in the belly area related to ovarian cancer and warrants a checkup with your doctor. The American Cancer Society says it could be linked to pancreatic, stomach, esophagus or lung cancer. Persistent cough that lasts more than 2 to 3 weeks and is not due to an allergy or upper respiratory infection or one that produces blood needs to be checked by your doctor. If your cough may be caused by smoking or being exposed to secondhand smoke, get it checked out because smoking is the #1 cancer killer of women. Unfortunately, the bad thing is that you don't have to be a smoker to be at risk. The majority of lung cancers that non-smokers get also occur in women. Frequent fevers or infections. Well, the experts say that a fever may simply indicate that your body is fighting an infection, but a persistent or prolonged fever can be a sign of cancerous condition such as lymphoma. Leukemia, a cancer of the blood cells, can also cause symptoms like frequent infections, fevers, fatigue, aches and other flu-like symptoms. Irregular bleeding. Here's what you need to know. Once you hit menopause, defined as 12 months without a period, any post-menopausal bleeding is a warning sign. Any bleeding, staining, little drops on your underwear or big clots are abnormal and should be immediately investigated. Fatigue. Can I ask you a simple question? Do you know what's fatigue? Fatigue is extreme tiredness that does not get better with rest. So if you're often fatigued, leukemia, colon or stomach cancer, which can cause blood loss, can result in fatigue. Fatigue can be a serious problem and it's easy to ignore. Skin changes. Be careful and keep an eye on any changes you notice on your skin all over your body and call your doctor right away if anything concerns you. Sores in the mouth that don't heal, especially if you smoke or drink alcohol, may be signs of oral cancer and should be checked by your doctor.